to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Nick Geralde. He's a neonatologist, and he wrote the Kevin MD article, A Different Perspective on PPE During the COVID-19 Crisis, and most recently, We Are in the Midst of a Crisis in Humanity. We'll get to those articles in a bit. First off, Nick, welcome to the show.
Well, thank you so much, Kevin. I consider it an honor. I just wanted to put my part in terms of sending out a message, and I appreciate, one, you all posting it, and two, now this honor of talking to you on your podcast. I really appreciate it.
So can you share with my audience your story and your journey to where you are today?
Going way back, I was born in the Philippines, if I can go that far. Came here when I was 3. Now, 50 plus years later, I'm now practicing in El Paso, Texas. How I came about coming here to El Paso was I was formerly in the military. I bled Army Green, and I did my residency and fellowship, in the San Antonio area. After I finished my 12 years of time, I had an opportunity to, practice anywhere, but I had a short stint in Odessa, San Antonio, but now for the last 13 years, I've been here in El Paso, Texas.
So I don't talk to very many neonatologists. How has
Yes.
the pandemic affected you and your practice?
Fortunately, it hasn't had the significant impact. I've always felt neonatologists are the subspecialists of subspecialists. We are a jack of all trades. We take care of a majority of issues regarding our baby, and we're insulated from the adult world. But it's been impacted, as you all can imagine, through the pregnant mothers that come through that are either PUIs or, God forbid, they're COVID positive. El Paso, being geographically separated from the rest of Texas, has been fortunate. We were a little slower in experiencing the impact, but right now we're in the midst of our impact. And I think all the mitigating efforts we were able to initiate before it actually hit our geographic area has been helpful. But as you all see, in most of you all are aware in the headlines, it's not a second wave, just a continuation of the infections, particularly in hotbed states, including my state of Texas.
So let's get to your Kevin MD article. The
Yes,
first
sir.
one you wrote back in April, A Different Perspective on PPE During the COVID-19 Crisis. And I want to start with an excerpt. You write, "These are unprecedented times we are facing, and there is a myriad of information and guidance we are asked to review and assimilate. This is not more information or guidance. Instead, it's a message of hope to reduce the hysteria, fear, and worry we are all experiencing." Can you share with my audience why you decided to write the article and share more details about that?
At the time, a lot of the information was, I felt, hysteria prompting. It was not intended to create hysteria, but hysteria was already beginning to set in. People were fearing the worst. There were people hoarding toilet paper, which is still very interesting. But the messages out there in the media were just, unfortunately, anxiety and fear-provoking. Personal protective equipment was uppermost in people's minds, whether in the healthcare setting or at home. And so, with the help of my wife, I came up with a twist of the PPE that I created. And I felt it was important. I initially intended to just distribute the message here to my local hospitals that I work at. It then expanded to the El Paso community. And then, since I had been subscribing to your emails, I thought, well, what better forum than to share it with physicians and other providers that subscribe to that, and to spread this message of hope and what we can do on an individual basis to protect ourselves.
And what's this new twist on the acronym that you created?
Yes, for the first P, it's protect yourself. That's where I asked those, particularly healthcare providers, and then extending to each individual person, we have to protect ourselves by doing the necessary things to, when we're at work, wearing a mask, wearing gloves, all the typical standard things, but also being mindful of we have to protect ourselves from a physical and mental perspective. I've been very guilty since COVID-19 has occurred. Of course, it doesn't help my gym closed, that I haven't been taking care of myself physically and as well as mentally. So I have to be, I have to subscribe to that recommendation each and every day, and I'm trying to do a better job of that. The second piece, to protect others. By doing what you can do to protect yourself, you're preventing any potential exposure you have to others, and then helping either the patients you take care of, your neighbor, your family and friends, what you could do to give them, to spread this word of reassurance of what you can do to protect yourself. And then the last E is for treating everyone with kindness, respect, and empathy, because we are all, globally in this crisis, and the hysteria had resulted in significant behavior, crazy behavior of sorts, and we just still need to treat each other with basic respect. And I'm a firm believer in the golden rule: treat unto others, do unto others as you want others to do unto you. And that was really the basic tenet of the E, treating everyone with kindness and respect.
Now, you wrote this back in April, and you said that there
Yes, sir.
was an environment of hysteria. We're now
Yes,
talking the
sir.
third week of June. Has anything
Yes.
changed?
I believe it has. We have been here locally and nationally setting into this new normal. For the most part, people are still trying to protect themselves, protect others. But I can understand those who have felt this cabin fever of being locked down and having to protect and wear masks at all times of the day, how they feel a sense of rebellion and want to just be free of those restrictions. But I'm hoping that because the restrictions have been in place, plus the majority of the people are doing the right thing, this new wave that we're experiencing, or an extension of what were the first wave, and any subsequent waves, will just be mitigated by people trying to do the right thing.
So you also wrote a more recent article. We are in the midst of a crisis in humanity. And of course, for the past few weeks, we have nationwide protests against racial injustice. And your article, as you call it, is a call to care. Can you share with my audience a little bit more behind the story of that article and why you decided to write it?
Yes, I'm Filipino American, and unfortunately, I've been victim of discrimination, prejudice, and a couple, unfortunately, of downright racist behaviors. And despite the fact I've been here for 50 years, I came in, I arrived here in 1969, shortly after the Civil Rights Movement. Yes, the Civil Rights Movement accomplished quite a bit, but it's been apparent, unfortunately, with the George Floyd killings and the other senseless murders or killings of people of color the last few months and in the last few decades, much hasn't changed. There still is this underlying seed of discrimination and prejudice. And I agree with others who are calling this a healthcare crisis. And as healthcare providers, we are, inundated still with COVID-19. We're inundated with trying to resuscitate our medical practices. We're still inundated with, everything that, this new normal, plus, our typical stresses of life. And so it seems intimidating how we as healthcare providers can make a difference in this issue of racism. And I just spent one night till 1 in the morning, 2 in the morning, coming up what I felt was a step-by-step approach we could take. And I asked that those who have a chance to read it, please look at it and look step by step by the points I made suggestions of, to please see what you can do. At the very least, take step number 1, which is where to take a self-assessment of your own attitudes and behaviors towards other ethnicities, and see if there might be some behaviors that you may have not thought of as being prejudicial, and being mindful of it, and hopefully being rid of that in your own mind. And then second, especially being a neonatologist and pediatrician, is I know that social media has a significant reach to well beyond adults. It also extends to children. And I have to admit, my wife and I have been very hesitant to talk about this issue with our daughter, our 7-year-old. I'm fortunate that I have 3 older kids, also 22, 20, and 18. I've been able to share that message with them. In particular, my son, my oldest, a 22-year-old, has been very involved in this. He was a former supporter of the Bernie campaign, and he's just become very socially and politically aware. And he has helped me open my eyes about this. And we had a conversation leading up to my writing this at what I could do, what little part I can do. And so it starts off with this message. I have plans to talk with our local public health officials and seeing what I can do to help spearhead making this an initiative for our local government. And then I'm hoping others will, follow, because racism is a shadow on our American history. There's more we need to do, and it really starts with each individual person looking at themselves and seeing what they can do. And collectively, I hope it will make a difference, and more than that, an enduring difference, a difference that will last well after I'm gone.
Well, thank you for sharing that. For other minority physicians who may be the
Yes.
target of racism,
Yes.
what kind of advice or tips can you give them?
I just tell them that, unfortunately, it's out there. We don't accept it, of course, but keep in mind that you accomplish a lot. You will not have one person, take that away from you. You, whether you're a physician, a nurse, respiratory therapist, no matter what your field is, you have taken an oath of sorts that you are going to do the right thing for that patient. So set aside the discriminatory, prejudicial behavior. Treat the patient in front of you, regardless of what that person's personal beliefs are. And then really, if the opportunity presents itself, take a moment to address that person's beliefs, and not likely that you're going to change anything, but at least making him or her aware that their beliefs are unfounded, to look at me as a person, regardless of my color, and hope that may strike a nerve in that person. But, all we could do is just take care of the patient in front of us. Don't let it deter us. And if anything, let it motivate us to make this a mission of, whatever form or fashion that you want to take it. But, realize this is a healthcare crisis and we can do our part. So.
Well, thank you so much for sharing your insight. On our show, we have Nic Geralde. He's a neonatologist. He wrote the Kevin MD articles, "We are in the midst of a crisis in humanity," and "A different perspective on PPE during the COVID-19 crisis." Nic, my final question. What is your take-home message for the Kevin MD audience?
I think I'll fall back on the golden rule. Please do unto others as you want others to do unto you. Quoting Rodney King way back in the LA riots, why can't we all get along? There isn't a question in my mind that we can get along. We all have an objective to live life to its fullest. We have to shed any prejudicial or discriminatory beliefs that we might have. The person in front of you wants to do the right thing. And if we all can share that same mindset, treat each other with dignity and respect, we can accomplish that goal, but it starts with us.
Nic, thank you so much for your time, and thank you for being on the show.